The objective of this study was to compare the short-term surgical outcomes of laparoscopic distal gastrectomy, LDG, with open distal gastrectomy, ODG, for clinical T4a gastric cancer, GC, a context where no prospective trial had been designed before. Conducted as the UMC Upper GI-01 randomized clinical trial, this was a single-center, open-label, non-inferiority trial at a tertiary hospital in Vietnam. Participants were randomly assigned to either LDG or ODG, both followed by D2 lymph node dissection, with procedures performed by qualified surgeons. Short-term outcomes comprise surgical results, 30-day postoperative morbidity and mortality, and recovery parameters. The trial included 208 patients, evenly divided into the LDG and ODG groups.
Quick take. This study reveals that laparoscopic surgery might be a viable alternative for T4a gastric cancer.
Results showed no significant difference between the LDG and ODG groups in 30-day morbidity and mortality rates, including overall and severe postoperative complications. However, LDG was associated with longer operative time and higher blood loss. Comorbidity emerged as an independent risk factor for complications in multivariate analysis. The authors conclude that LDG presents comparable short-term outcomes to ODG, suggesting it as a feasible alternative for clinical T4a GC, pending long-term outcome evaluations.
Quick take. LDG could potentially replace ODG for gastric cancer without compromising short-term outcomes.
Short quiz, clinical vignette. Question: a 62-year-old male with clinical T4a gastric cancer is considering surgical options. He is informed about a trial comparing laparoscopic and open distal gastrectomy. Based on trial findings, how does laparoscopic distal gastrectomy compare to open distal gastrectomy in terms of short-term outcomes? Option A is it shows higher postoperative mortality rates. Option B is it demonstrates longer operative time and higher blood loss. Option C is it reveals increased postoperative complications. Option D is it offers quicker recovery in terms of postoperative hospital stay.
The answer is option B. The trial found laparoscopic distal gastrectomy had a significantly longer operative time and higher median blood loss without affecting short-term morbidity or mortality compared to the open approach.